Hello. This again is nurse practitioner Ivanyako. If you're Carolyn from the practice where your health is our priority. We take pride in that. We pamacho this month, a health and wellness month. So we are talking everything about health. Bibia ya kasibia for wellness, for health. It's me pamacho no na ya kasa video, couple of videos on our pages, on our Instagram page, our YouTube page, and on our Facebook page. It's me pamacho. Make sure you go there and then you get all those information because they're good. If it's not for you, it's for somebody, and make sure you're sharing it to your family so that they could all learn from what we are all learning. Me pamacho and ne adia ba kwa yebe kan ho asem chlamydia. So what is chlamydia? Chlamydia is sexually transmitted disease. It's just what it is. That means you get it from having sex with somebody else, right? That's how you get it. Now, what are some of the symptoms that you're going to get from getting chlamydia? Most of the time, when you chlamydia, they don't even know that they have it. But the bad part, and then they say, a bit to me, how, especially with embar, causing infertility or damage to your womb, anyway. It's a very, very serious thing. When you are not able to tell until weeks after, and then I'll start symptoms, and what are some of the symptoms that you get? Symptoms are when your vaginal discharge, a very smelly discharge, and I say itchiness and burning in the vagina area. Now, so when you say when you bibisa, speak to your healthcare provider. There are treatment about it. The only way for you not to get chlamydia is not to having sex. And I also say having sex with somebody that you trust, that both of you trust each other and are not sleeping around. That's when you've tested and both of you are negative. That's the only way you cannot have it. But we are normally younger people to the age of 25. They play around all the time, so they are very prone to having it. You can also get it when you do have oral sex with somebody that do have chlamydia. And yet, any only vaginal sex only, but anal sex, oral sex, regular sex itself, you could get chlamydia from that. Me pamacho. Who said when who bibisa you want to follow up with your primary care doctor. Let them know what happened. Most of the time, at your man said, if you're Major Johnson. Na omako test yashe, and also say the way of they could give you a swab to swab a little bit discharge from the vagina area, and then we take it to the lab and assess it. When you have chlamydia now, you draw why you between your mouth antibiotic. The most important thing is that when you know you have it, you have to tell your partner also that this is what happened, so that they could also be treated. We have treatment now. Normally it's either 1 pill or 7 days pill. Whichever one they gives you, say a 1 day pill, you have to wait for at least a week after before you go back to having sex again. And if it's 7 day pill, you have to make sure you complete all the pills before you go back into having sex again. It's me Pamcho. This is just a short video from us. It's about chlamydia, and it's a sexually transmitted disease. If you know you have it, seek a doctor. Pacho will need doctor. A Carolyn family practice where your health is our priority. We patch your Friday, 929-450-4440. Was 650 East 226th Street, Bronx, New York, right here in the Bronx. And we are here. Your health is in our priority. We take very pride in that, in taking care of our patient, and we make our patient really feel comfortable when they come into our pressure. So we'll be happy to have you in our presence. It's in Patch of Fred. It's 929-450-4440. We cannot wait to have you. Thank you, and until we meet again, this is nurse practitioner Ivanyako. Love you.